as it says, I'm Bruce Harrison. I'm the operational manager of Leicester South Foodbank, which is a trussel food bank. It used to be called Trussell Trust. They got branded and now dropped the trust, and it's just Trussell. So we're one of 7 in Leicester and Leicestershire. Well, if I can get this to work, that would be great. So about our food bank, we provide 3 days worth of food, and it's worked on a voucher system. If you're a family, it lasts a lot longer than 3 days. It'll probably last at least up to a week. The charity now isn't just a food bank. We've got 23 food bank centres around Leicestershire, and one of the things we don't do is put a food bank centre where there's already a provision. So, for instance, New Parks, Beaumont Leys, they have some very good provision. As Monsell, I can see that one of the people are on here today. As Monsell has an extremely good provision. So the idea isn't to put loads and loads of food bank and duplicate work and duplicate support. It's to basically fill the gaps that are there. We're trying, our whole strategy is actually to the reduction of our food banks and hopefully move people away from food banks. We have about 80 volunteers. That comes around. Sometimes there's more, sometimes there's less. We have a regional distribution centre supporting 20 other food poverty organisations. The advantage of the RDC is that people can buy through us. So we've been very fortunate in being able to negotiate with some of the large retailers, Morrison's, Asda, Aldi, and Tesco, people like that. Now, although we don't get it at cost, we still get it at retail. We can pass it on to you exactly. So if we buy a tin of beans for 28p, that's what we would charge you. We'd just charge you a £10 delivery charge, not on one tin of beans, obviously, but on a pallet of things. But what it means is that smaller organisations who get donations of money can actually buy through us because it's a catch-22. You'll be caught if you've got less than £10,000 to spend. The larger retailers won't let you buy from their RDCs on pallet loads. It's too small. But if you've got £1,000 to spend and you want to go into your local Tesco, they won't let you spend that £1,000 in their Tesco because you're stripping their shelves, and it really messes up their ordering system. So a lot of organisations are caught in the catch-22. So we offer a service where you can literally buy through us. It's not a warehouse. It's not a wholesaler. So if you want fancy products, you're not going to get them. If you want tins of meat, yeah. If you want cereal, yeah. If you want the staples, not a problem at all. But if you want fancy items, you're not going to get that through us. But it just means that it gives you a and we deliver it to you. So you don't have to send volunteers off doing your shopping and things like that. We have specialist debt and benefit advice, but we definitely use Melissa and Citizens Advice and Contact Plus and everybody else, to be honest. Although we employ 6 debt and benefit advisors, specialists in their fields, they're overwhelmed. There's just no way they can cope. So we refer out to other organisations as well. To that extent, we're just opening a community hub in Wigston. It's the old council's, Oakley and Wigston Council's customer service centre, so it's actually perfect. And what it's going to be is an expo for other organisations. We've been very fortunate to get at least 3 years funding. We've got a 5-year lease, but we've got at least 3 years funding. So any organisation, anybody on here, or anybody working in to support people can book space, and it's not going to cost you anything. You might have to buy me a cup of coffee or a cake every now and again, but it doesn't cost you anything. You can book it. The whole point of this hub is that we have a plethora of organisations rotating through, And I'm hoping, Elaine, you will come and grace us there as well, as you have done in our at the King's Centre in the past. But anybody can, once we've got it set up, the booking system that is, you can book tables to hot desk, you can book the video conferencing software, you can book the interview rooms, you can book just to come and sit and have a cup of tea. It's entirely down to you, and it's all free. Whether that will stay like that or depends on the funding, but definitely for the first 3 years, that's what can happen. And what that's come from a forum of people with lived experience who have basically said, we want somewhere to go and talk to people. We're fed up of the phone calls, we're fed up of going on the internet, we're fed up of doing this and fed up of that. I just want to see a friendly face. I want to see somebody smile at me and just sit down. And even if they don't solve the problem, I feel happier just because I've had that human contact. Now, I know that's not always possible. And so there are alternatives, SMS and video conferencing and emails and all the things that we do use. But this is hopefully bringing back the face-to-face that a lot of us lost during COVID. Our referral process is on a voucher system. So basically, the whole idea basically is that our hubs shouldn't issue vouchers. Our hubs should just redeem vouchers. So to that extent, any organisation who is dealing with people that need emergency food parcels can be trained to issue the electronic vouchers. It's a very simple. The first time somebody comes to us, we take it completely at face value. It doesn't matter what they tell us. It's completely, yeah, fine, we'll totally accept it. After about a few times of people coming, we want to drill down and we want to find out why they still need to be using a food bank. Don't get me wrong, we've got some families that have been on our books for about 3 or 4 years, and it's simply because, one, it's their chaotic lifestyle and issues just keep coming up and up and up. Some people have got mental health and they're just struggling to sort the life out to be independent of a food bank. But on the whole, the majority of people come 2 or 3 times, 4 or 5 times, and we don't see them again. And that's how it should work as a food bank. We've got about 64 referral agencies all over the city and the county. And we also have a free phone number, which is a national number, Help Through Hardship. It's part of the National Citizens of Advice, paid for by Trussell. And that's a free phone number that people can ring up and get a referral if they have no other alternative. So, as we all know, the effects of COVID and the cost of living. Well, COVID increased our demand. We were doing about 5,000 people a year, and then COVID came, and that jumped to 26,000 people. Absolutely ridiculous. It was crazy. We were working 7 days a week, like I'm sure most of you guys were as well. It was just ridiculous, and those numbers are slowly starting to come down. But why were they there? Because there was never a shortage of food. There was problems with supply, i.e. getting it there, but there was never a shortage. Our first delivery to our warehouse in 2021 was 98 pallets of toilet roll. There was never a shortage of toilet roll. It was just that people panic bought. 6 months into the pandemic, we were getting phone calls from people to say, oh, I've got a garage full of stuff, do you want it? It was just ridiculous. The media just made everybody panic and everybody went to the shops, and that's why it got restricted. The assumption was that anybody could use a food bank. Basically, the government said, you've stubbed your toe, go to a food bank, they'll sort it out. It completely set us back, because food banks are an emergency provision only for crisis. But everybody was coming and saying, well, I've been told to come to you. Everybody was coming for anything. We've got people who basically were doing online shops and basically said, well, it's easy to get it from the food bank. And we're saying, no, you've got money. This is not for you. This is not your provision. It's really hard. And then due to overcommitment, and we've heard from Elaine and Melissa, and I'm sure Jonathan gets this as well. And we all do it. It's not a judgment call. We all do it. We overcommit. But people, I used to do a talk before COVID, and I used to say to people, please just go and do a basic income and expenditure. And I says, once you've got that, if you manage to balance that income and expenditure, take away 10 or 15% and then see if you can balance it. And that 10 or 15% could be that you've gone sick, long-term sick. It could be you've been made redundant. It could be that you've had a relationship breakup. But you lose 10 or 15% of your income, you will be using a food bank. And that's exactly what happened when COVID came. People weren't prepared for it. And I'll put my hands up. I struggled because we weren't prepared for it. We took everything for granted. And we were not prepared for the huge rise in the cost of living either. So as we came out of COVID, we were hit with the cost of living. And then we've now got, obviously, the conflict, world conflict and policy has continued to increase financial hardship. We're not coming out of the financial hardship side of things. And it's great to see the services and the guests that are on here that offer such fantastic services to give people hope, basically. So our vision is to reduce the need for food banks. We really do want to see food banks as a thing of the past. I can't see it. I do think there'll always be a place for food banks. There has been for thousands of years in various forms. So I can't see we'll ever get rid of food banks, but we've got to get them back to where they were. And that is an emergency provision only. To do that, we've made sure that the people that need our services can easily access our services, and we ensure that referrals are appropriate, so good training for our referrers and asking the right questions. We've had several people that say, oh, I need a food parcel. When you've spoken to them, they don't need a food parcel. What they need is affordable food. And you just say, well, if you did this, you do that. Oh, great. Okay, yeah, great. And off they go. Some people actually, it's a cry for help. So we've had people in domestic violence situations. They didn't need a food parcel, but they were so scared to go to the appropriate authorities like the police, domestic violence units, things like that. They came to the food bank, and then they started to trust people, and then it came out, and then you suddenly realise, hang on a minute, this is a safeguarding issue, and we were able to help people that way. Not saying no, we never say no. We don't always give a food parcel, but we never say no. There's always an alternative provision that we will find to help somebody. So we never say no. And ensuring more solutions. Things like this is fantastic. The more we partnership work, the more we work together, the more solutions. There's thousands of solutions out there, hundreds of thousands of solutions out there, but we need to work together on it, and which we are doing. And I've seen it over the last couple of years. It's been fantastic. So partnership working, taking time to refer and have a single point of access. I'll explain that in a bit more detail in a minute. Good networking with other organisations. Get my teeth right in a minute. This is really good. Leicestershire communities and all these different forums that we go to. That's what we need. We need to talk. We need to make sure we know what each of us is doing, and we don't need to be afraid of each other either. Good communication and not duplication. And joint funding initiatives. Everybody's looking for that funding, but what we need to do is not be worried about it. Most funders want to see partnership working. If you put a partnership funding application, you've got more chance of getting it than somebody who goes solo. So that's the sort of stuff we need to be doing as partnership working. And then campaigning for, I'm really struggling with my teeth, campaigning for change. So listening to those that we serve, empowering people to have a voice, and facilitating community forums and giving people with lived experience a seat at the table and challenging decision and policy makers. If we're not listening to the people that we're trying to serve, how do we know that we're doing it properly? How do we know that the provision that we are providing is the provision they actually need? So we're starting to increase our community forums. We're going to have a working group on our community hub to look at the direction and travel that community hub needs to do. And we will adapt. It will be organic, and we will change it to what the people of Oadby and Wigston need. And hopefully it'll be a model that we can replicate in other parts of the city and the county. So when we look at things, we've got the client. The client comes along, and that's the red light. We got the point of access. The point of access should be any of our agencies, any of you guys, any of us. If somebody comes to me and says, I need such and such, I shouldn't go, oh, well, you need to go and find that yourself. I should be able to say, oh, I know that person. And I've got a referral form for that. Or sit down. Let me give, Melissa a ring, or let me give Elaine a ring, or whoever. And and help that person through that first step, we shouldn't be afraid to refer to other agencies just because the person who's come to us. People should see each agency as a single point of contact, a place where they can go in. And that's where we make the referral, phone, face-to-face or online, or all the different ways we can do it. We can't all do face-to-face, it is difficult. And then provision, we've got emergency parcels, advice, counselling, community fridges. Fantastic. I want to see more community fridges. They're brilliant. Pantries, community pantries where people have a membership and we'll go on. Affordable food and cooperatives. I don't mean the co-op, I mean cooperatives, where you've got about 20 people working together to feed themselves. And that is so sustainable. I'll talk about that model if you come into the room later on. Signposting, making sure we're using the Joy app, Step, or other forms, you know, the Contact Plus, all the websites that have got fantastic information on them, making sure we're doing that. And then we will get the outcomes that we all want, which is improved health, well-being, sense of hope, employment, employability, positive outcomes, community cohesion. If we don't get community cohesion, we'll just continue to be a sticking plaster. We want the community to work together. We are part of the community and we want that community to be part of us, and then we work together, and that will lead to financial security. We all know it's not the golden ticket, so we know that, yeah, we can solve one problem, but they're holistic problems, and what happens is we go back and start again. That's not a problem. If somebody needs to use the services again, not a problem at all. But let's try our best to keep moving them through that journey. And then finally, what have we learned? Well, we've learned it's a person-centered approach, and we must be accountable. You know, if somebody donates a tin of beans to me, they expect that tin of beans to go to somebody in need, not somebody in want. So I'm accountable for every donation that we get. Reaching wide and focusing on more than food. We can't just focus on food. It's a sticking plaster. It's a fantastic way to get people to talk to us, but we've got to look for more than food. Ensure that the person always comes first, and the person-centered approach. Face-to-face before other methods of engagement. And I know that's easy for us to say because we can do that, and not every agency can do that. But be accountable. Make sure we are. This is why I asked Jonathan about the client journey. I'm really interested. If I stick a referral into an agency, I really want to know what happened to that referral. If it broke down, where was the breakdown, so that we can learn from that and make sure the client journey is better from then on. Maintain oversight of people's experiences, journey mapping and case studies. Well, that's me. I hope that hasn't been too, I don't know, dogmatic. I don't know, can't think of the right word. But I've put my email in the chat. So if you're not coming into my breakout room because you've had enough of me, absolutely no problem at all. You can always email if you want more information. And if you are an organisation that wants to have a bit of space in Oadby and Wigston, then please email me and come and visit the community hub. Thank you.